Hello, everyone, and thank you for joining today's webinar, Being Resilient, That's Live Enterprise. Leverage AI and digital technology in healthcare during a pandemic and beyond. This webinar is sponsored by Infosys. Infosys is a global leader in technology services and consulting. Infosys enables clients in 45 countries to create and execute strategies for the digital transformation. From engineering to application development, knowledge management, and business process management, Infosys helps its clients find the right problems to solve and solve them effectively. Infosys' team of over 198,000 innovators across the globe is differentiated by the imagination, knowledge, and experience across industries and technologies that they bring to every project they undertake. Visit Infosys.com to see how Infosys can help your enterprise thrive in the digital age. I'm Sean Edwards, Director of Marketing Ops for World Congress. I'll be introducing today's webinar. Before we start, just a couple of housekeeping items. If you're having any problems viewing the discussion or encounter any technical difficulties, please use your chat box and send a question directly to me, the host, and we'll try to help you. Second, I'd like to explain how we're handling questions. Now, due to the number of attendees, participant lines are muted. However, if you'd like to submit a question for our presenters, please do so using the Q&A feature at the bottom of your screen. We'll answer all the questions that we have time to address during today's program. Finally, please feel free to contact our presenters with any follow-up questions. Please note that this webinar will be recorded, and you'll receive an email with a link to the video so that you can view it again. Now I'd like to introduce our speakers. Abhishek Singh is Vice President of Everest Group, and Venky Ananth is Senior Vice President, Global Head of Healthcare at Infosys. Without further ado, I'd now like to turn it over to Abhishek to get us started.
Thank you, everyone. Good morning, good afternoon, good evening, wherever you are. Just wanted to start off by sharing what we will be covering in the presentation today. So I will be starting off by giving you an overview of the healthcare industry and how digital and AI technology are getting used there, specifically from a care management perspective. And then I'll be handing it over to Venky, who will be taking you through the rest of the three items, which is role of digital or AI in care management, some of the use cases that he wanted to share with you, and engagement approaches that he would want to talk about. So let's jump straight away into the overview on care management. So one of the things that none of us can deny is that healthcare as such is at the center of the storm when it comes to the current crisis. Since coronavirus crisis hit countries and industries globally, healthcare has been one of the industries which has been at the forefront of dealing with it. So whether it's from the perspective of dealing it as a health crisis or being impacted by it as regards a financial crisis. In the last 12 weeks or so, being an analyst, a researcher, I have spent time speaking with various components of the ecosystem that are there in healthcare, whether these are folks who procure services, supply services, investors in these areas. Primarily what has come out are these four themes in my discussions which have stood out as regards problem statements or focus areas on which most participants in the industry are focusing on. Top amongst that is care management. Others are clinical orchestration, where clients are trying to focus on triaging for critical functions, whether it is in relation to triaging for clinical services, or even from the perspective of financial triaging, which I will be touching upon more from the perspective of care management. Then there is this entire issue about supply chain, procuring PPEs, masks, medications, etc., and getting them to the right places at the right time by the bedside is one of the other challenges that most healthcare organizations are currently focusing on. And last but not the least is this entire debate about data democratization and security, which is at the forefront of how decision-making is made within organizations as they leverage data through their technology systems to make quicker and faster and value-oriented decisions. But for today's discussion, I'll be focusing my energies on the care management aspect. So before I jump into the details of what's really happening within the care management space, what I wanted to take a stab at was answering a question that you probably have in mind, which is, what is care management? I know there are so many definitions that go around care management, which ends up making an umbrella term for a lot of people. It could actually mean nothing. So just wanted to call it out what it really is. Care management has kind of become that binding glue, which is bringing the entire healthcare and life sciences ecosystem together. So whether it's life sciences, pharma firms, payers, and providers, when they deal with these two core components that you see on the left and the right-hand side of the central box, which is care intervention or wellness management. So either if you are talking about contingency-driven issues related to care, which comes under care intervention, or ongoing activities related to wellness management, all gets encompassed under the umbrella of care management. Hence, anything, whether it's diagnostics, treatment, medical adherence management, monitoring and tracking, patient profiling, all of these are areas which form part of what we like to call care management. Now, jumping into the core topic as regards what has been the impact of COVID-19 on care management, one thing we have to be very clear about. Care management was already growing in profile, even pre-crisis. But what COVID-19 has done is created a forcing function on certain aspects, which we need to talk about. So what are these forcing functions that we are talking about? Let me take a few examples from some lay examples from our general life, and some of which you might also be facing and encountering on a day-to-day basis. So let's pick video communication. How much of video communication were we doing prior to the crisis? Maybe a bit, but I have seen that exponentially jump. Some usage of e-commerce has undergone a significant jump pre-crisis compared to post-crisis. And I even wanted to share a personal anecdote. Pre-crisis, I could not even cook an omelet to save my life. But if I could invite you to my home today, I'll probably whip up a 7-course meal in a jiffy. And that's what I wanted to share from the perspective of the impact, the forcing function that COVID-19 has, so to speak, become on all aspects of our lives and on different industries. So when it comes to healthcare, or specifically care management, what are some of the changes or focus areas that have become more emphasized compared to earlier? The first one amongst them is the focus on high and rising healthcare spend. Now, it's anybody's guess that healthcare spend was already a political hot potato. But in many ways, given that currently a lot of health systems are in different kind of distress, whether it's from the perspective of elective surgeries getting pushed out, whether it's from the perspective of their staff who are either overworked in case they are focusing on COVID-19 issues, or are being furloughed in case they are not related to COVID-19 issues, is bringing the focus back on how high and rising healthcare spend is kind of going to impact this entire industry. And which naturally kind of creates the segue into the second topic that I will be focusing on today, which is the entire shift towards value-based care. Again, value-based care has been discussed for decades. It's not a new topic as such, but then there is a natural segue that is getting created on the focus on quality-driven outcomes that is bringing value-based care back into the focus during the current crisis. In the last 12 weeks, I've heard so much about it, and I'll be sharing more on that. Third one in the list of topics that I'll be touching upon is the remote medical care. This is kind of the operational aspect of care management, wherein we have seen a significant uptick. In fact, I would say that telehealth as such has gotten a lease of life, so to speak, because of COVID-19. And last but not the least is the theme, which is kind of an undercurrent to all the other themes that I just talked about, which is kind of creating that foundational base for care management as a function to succeed. So let me pick up the first one, the focus on cost. What's really happening there? If you are someone who does not have a government-based plan, you are in the United States, you would always wonder what happens to each dollar of the premium payments that you make to your health insurer. How your individual dollar gets split up is actually what is shown on this slide. 80 to 85% per government mandate is actually supposed to go towards medical costs. Even within medical costs, whether it's prescription drugs, physician services, outpatient services, or inpatient services, which your premium dollar pays for, has been a kind of source for debate for a while, as pharma firms, governments, providers, payers all try to bring down costs there. But there is already, even if we go beyond some of these aspects of cost reduction into each of these medical service areas, we know for a fact that there is somewhere between a 5 to 10 percentage point bloat when it comes to care management issues related to utilization management, so to speak, case and disease management, provider monitoring and education, whether it's waste and error elimination. A lot of these are areas which are interestingly becoming themes on which a lot of healthcare participants, venture capitalists, governments are currently focusing their energies on to bring in platform-led efficiency. And that is why this entire debate about cost and how it lends itself to a focus on technology is becoming more and more prominent during the crisis. Next up is this entire debate about value-based care. And in many ways, the topic that I was just talking about, which was focused around cost, VBC or value-based care is a natural consequence to that cost plus quality orientation that healthcare organizations are now gravitating towards. However, the thing that we should acknowledge at this point in time when it comes to value-based care, especially in relation to how we see it happening in the United States, is that it's still heavily weighted towards the federal programs. When it comes to commercial plans, commercial programs, we are still seeing less of that happening, but that's increasing. And that's one of the things that we are seeing change because of the crisis. So for example, if you look at the second example, which is the Humana example about saving $3.5 billion in healthcare costs through their Medicare Advantage value-based care programs, is a case in point or a very good example of what are the kind of outcomes that VBC can achieve for the industry. Essentially, if you look at the third example in this mix, which is the September 2019 example of United Health subsidiary Optum kind of evangelizing this idea of VBC by breaking down technological barriers and persuading providers to adopt these technology tenets to deal with VBC, I think was one of the very early examples of what has played out during the crisis, wherein clients have started asking this question as to how and where we can start having that discussion about VBC, not only from the perspective of having a focus on costs, but also from the perspective of value that you can derive. Next slide, please. Yeah, thank you. So when we look at the VBC itself, interestingly, data management and analytics capabilities have become the backbone of adopting any value-based model. So while there are other aspects of debate in VBC about what metrics we need to adopt, what kind of outcomes that we need to define into VBC contracts as such, but the core underlying layer from the perspective of the technology-based discussion that we are having right now, I think whether it's data-driven personal care, need for interoperable systems and effective use of HR, these are the themes which are needed to accelerate the move towards VBC. And that's why it's becoming important for us as industry participants to continue evangelizing these ideas. Next slide, please. Oh, sorry, I think I've got the control back. Next up, and I think this is one interesting topic that I really wanted to touch upon and spend some time on, which is around the telehealth and the remote work aspect. If you look at it, even before COVID-19, we were seeing telehealth or remote health kind of grow in traction. Some of the examples that you see on the left-hand side bring to bear how some of the large payers, whether it's United Health, Humana, Highmark, were already starting to invest or double down into this particular theme. In fact, now in the last few weeks, we have seen many more examples of that happening. So the examples that you see on the right-hand side, it contain leveraging the Optum and the MedStar example, plus the exponential jump in utilization of the telehealth companies like Teladoc, American Well, etc., brings to bear how fast telehealth has grown in adoption. And in many ways, we need to also thank government for enabling this, because the relaxation of norms on out-of-state licensing to enable telehealth and patients to kind of access doctors across states has kind of aided in this movement towards remote health. Net-net, when we are talking about this, there is growing consensus from what I have heard from clients in the fact that efficient telehealth can lead to better care access, reduce costs, and at the same time improve outcomes, especially on aspects such as chronic care. And we have picked up multiple examples in relation to that. So that brings me to the fundamental topic of the day when it comes to what is really driving all of these themes, and which is the technology aspect of it. In fact, I just wanted to kick off this topic by sharing my thoughts on a LinkedIn joke that was going around, not only on LinkedIn, but other parts of social media, which was around a poll for a question that somebody had put, very interesting. And the question went like this: who is driving digital transformation for your company? And the options were: option 1, CEO, option 2, CTO, and option 3 was COVID-19. In fact, I don't know whether these are real results or fake results, but COVID-19 was kind of the hands-down winner when it came to the results of the poll. I don't know whether this was a real research or just made up just to kind of make a tongue-in-cheek kind of point, but the fact remains that during the crisis, a lot of organizations have realized something, which is that there is something called a digital divide that exists between organizations who had adopted the right kind of technologies prior to the crisis, focused on business resilience, or having the ability to adapt new normal, which allowed them to stand out in comparison to other organizations who had not done that, and in many ways are considered to be laggards when it comes to their ability to deal with business continuity, service continuity, or in dealing with the crisis. There is no two ways about it that there is a consensus that technology is kind of creating that impact on costs, on operational continuity, and also certain elements of business impact. In fact, in most of the conversations that I have in the last 12 weeks, CEOs, CFOs, and COOs have woken up to the fact that digital technologies create impact far beyond the supporting functions of IT and operations. And that's something I take a lot of heart from. In fact, some of the themes that we have picked up in the last few weeks have been focused on things which are mentioned at the bottom of the slide, which are around strategic hiring for new influential roles, which are directly related to the outcomes that providers and payers want to focus on. Second one is around streamlining internal resources with a focus on innovation, and especially so on change management to drive internal digital adoption, because it's one of the big challenges that especially the health systems have faced, that even though they have adopted technology, spent billions of dollars on EMRs, EHRs, HIT, internally to get clinicians, administrators, nursing staff to adopt those has always been a challenge. So I think this is one of the most important aspects that healthcare providers are currently focusing on. Last but not the least, interestingly, is this whole aspect of leveraging partnerships, working with service providers, startups, large technology companies like Amazon, Microsoft, Google. And I mean, you would have seen, I'm pretty sure, in the last few weeks as to how many healthcare specific announcements that organizations have made in order to help healthcare organizations, one, to wait through the crisis, and even to think of aspects and themes beyond the crisis. In fact, one of the examples that I have been involved with on the advisory side, we are helping out with a couple of providers, in fact, large health systems, who are thinking of outsourcing for the first time. And given the current scenario, I think that is surprising, but not really something that you would be scratching your heads on, because in many ways, the first generation outsourcing thinking in the provider systems has come about primarily with a lens of leveraging economies of scale, driving down costs. And in this scenario, when most organizations are facing issues of financial distress, I think that can be a lifeline for a lot of organizations. So sharing a bit more around what we have seen and heard from our clients. We reached out and researched some top 10 peers and health systems across the industry in the United States, trying to get a sense of the use cases with a focus on technology that they were focusing on. Interestingly, if you look at this chart, this is a very busy slide, so I won't be going into each of the bullet points, but if you look at care management under both boxes, that was the one place where most payers and providers were leaning on. Most of the use cases were actually coming out from these two areas. 60.9% of payer use cases were focused on care management. 50% of use cases related to technology in the provider health systems were focused on care management. So that's been the extent of the shift or focus towards care management that we have seen in the last few weeks. Then we double down a bit on care management to see what are the themes that organizations are really focusing on from the perspective of digital technologies. There are two buckets that are here. One is the automation and analytics, which organizations have already invested in the last many years, which continues to emphasize itself during the crisis. And there are two other areas, artificial intelligence, machine learning, and the focus on Internet of Things, which is emphasizing itself and becoming that growth driver during the crisis, with an eye, by the way, on the post-crisis themes. In the use cases that are under our adoption, we try to dig deeper into the aspects related to analytics and automation. If you see the smattering of use cases that we have seen, whether it's on analytics on the left-hand side or on automation on the right-hand side, things such as medication adherence, health risk assessment, determining medical data management, pre-authorization, or on automation with a focus on records tagging or records extraction, case allocation, etc. We have already seen that bit of change taking place in those areas. Now, the question here is, as we are observing some of these investments being made, as organizations are pivoting towards leverage of technology towards care management, what is the key takeaway that we are taking from this thinking or orientation towards technology investment? And that is what my key takeaway for today is. If you look at it, what this picture showcases is the fact that when it comes to organizational thinking around digital spend, or how they leverage digital technologies for their entire spectrum of services, whether it's back office, mid office, or front office, we have seen that patient-focused digital has always taken a majority of share when it comes to the narrative, the market messaging. But fact of the matter is, a lot of the patient-focused digital initiatives that we have observed in the last 5 years or so, analyze them for their efficiency and outcomes. We realize that most of them, in fact, and there is another survey that I could refer to, wherein healthcare executives, almost 78% of them ended up mentioning that their digital focus initiatives did not succeed. Why? The reason is their digital plumbing was not enabled or fixed to help their patient-focused digital succeed. And what do I mean by digital plumbing? These are aspects related to operational digital and secure digital, which need to be enabled first to make your patient-focused digital succeed. So things such as improving on productivity by leveraging analytics, AI, or ML, ensuring change management, process change management happens when it comes to revenue cycle, your care management processes. Having a strong view around data and engineering, and ensuring that your organizational agility or business continuity is enabled through a cloud transformation philosophy, while at the same time ensuring that you are compliant with government norms, ensuring that your medical records, your personally identifiable information is secure for all the patients that you take care of. These two aspects need to be fixed first before you start to even think of outcomes on patient-focused digital. Hence, we are currently seeing a renewed focus on digital plumbing. In fact, 85, if you add up the two numbers on the left-hand side, the 45 and the 40, 85% of the organizations whom we polled, the senior executives, ended up mentioning that this digital plumbing is going to be their priority during the crisis. That's what they are going to focus on, with the primary objective of building business resilience and ensuring that they have or build the ability to pivot to a new normal once this crisis recedes and they come out of these challenges. So on this note, I will hand it over to Venky to take you through the rest of the presentation.
All right. Thank you, Abhishek. Always fascinating to hear your pan-industry view. Good afternoon, folks. And my name is Venky Ananth, and I'm a Senior Vice President and head of Global Business at Infosys in Healthcare. So today, with that background, Abhishek spoke about technology spend at payers. I think I heard 60%, providers 50% of the spend in care management. It's pretty staggering. And I just want to share with you what we are doing at Infosys. How can you make this real? How can you really bring in AI into the real world? How do you kind of bring that technology to bear to meaningfully be embedded in your day-to-day processes so that your care processes are much more superior, better outcomes, reduced cost, etc., etc. So that's really what I want to talk about. It's a very thin sliver of what we do for a living, but just to give you a sense of the possibilities given the time constraints that we have, we thought we'd just share that with you. So if you look at something like care management, what we're looking at is, okay, I have slides jumping all over. So if you look at a care continuum, the way we think about it is there are broadly 4 pieces. And if I start from the right, the evidence generation piece is really about how do you pick up all the data that is around us. One is the real world patient data that's coming out of your diagnosis, your specialty visits, your treatments, your diagnostic procedures, etc. So that's real world patient data. The second piece is the whole device and sensor data that obviously is ubiquitously available for all of us. I don't need to talk about this. There's a monitors, sensors, wristbands, etc. Then there is, of course, the supply chain data that's available largely around pharmaceuticals, etc. that's available that you could possibly use. And the last one, of course, is essentially your social demographic data, the media data, the entire digital footprint that all of us leave around that. So when you start thinking about this, all are important sources of information. And I'm going to shortly talk about how you can use all this to meaningfully make interventions during the care management process. The second piece of the puzzle is really the processes and the workflow that every organization has, be it a payer or a provider. What kind of provider interactions are you having? What processes do you have today for claims authorization, refills, patient engagement piece? So is everybody able to hear me? I think I have a question here that its audio is clear or not. Is there an audio problem? Abhishek? Okay, we can hear you. Awesome. The third piece is really the AI and ML analytics piece. So this is something that I'm going to dive in a little more, a little deep, because this is really the crux of what we do, which is really how do you use AI to practically do disease detection, right? How do you kind of bring in this technology during the care management process, right? How do you use natural language processing to kind of understand the medical literature, the reports that surround us, and start using them meaningfully in the care life cycle? And lastly, the workflow and the process automation. The fourth piece really is the personas. So we have a care coordinator, the care manager, the administration, the member information. So you have all of this together. So the idea is you bring all these 4 pieces and start answering questions like this. How do I create a digital ecosystem in my organization to predict the right intervention? Awesome. So how do I create this digital ecosystem to predict the right interventions? How can I predict the disease detection for a patient, right? How do I figure out whether a potential refill situation, a stock out situation in a pharmacy center? So these are the various things that you want to really ask and have answers to, right? The fourth one is really how can I orchestrate a better personalized experience that we've been talking about for a while. And lastly, how do I enhance the PA, the prior auth, and the refill process to help, particularly during the post-COVID scenario that we are in. So that's the main idea. The question, the flow we are going through is what are the questions that we're trying to answer ourselves, and then what kind of technology, how do we bring technology to bear to answer these questions. And I'm kind of laid out, a simple workflow on how do you kind of picture or imagine in a patient journey, right through at the start. What you have is, when you see the number one, the point one here, you're talking about how do you do risk stratification, right, with overlay of hotspot. So once you do that, then you are basically able to use AI to predict adherence, use risk profiles, and starting to use events and patient pathways based on risk stratifications, so that you can kind of start making interventions, which is at step one. Again, at step two, what you see is in terms of monitoring of patients, right? How do you start monitoring patients for, once they've been tested for COVID? And this is possibly in conjunction with if the patient has got, comorbidities, possibly diabetes, etc., right? So that's really the point here. And lastly, once you have, a patient in a recovery stage, and once he or she has been discharged, how do you kind of use technology to understand and ensure that there are no side effects because you have a set of existing treatments combined with your own, recommendations and prescriptions that you are recommending to the patient because of COVID. So this is just to give you a sense of, what are the questions that we need to ask ourselves? How do you orchestrate the different pieces in the care continuum? And how do you bring it to bear in the context of a patient journey to figure meaningfully or bring in AI meaningfully during the patient journey at appropriate points? So with that, I'm just going to dive in straight away into a use case that illustrates what we're talking about. So one is that what we did at Infosys is we used real world data and try to understand. We kind of used about 100+ predictors for specifically. I've just taken diabetes as a disease as an example here. Across demography, between age, gender, ethnicity, across the clinical data that I spoke about, which is a diagnosis procedure, specialists, and the variety of treatments that are available, the device data that is available, and the consumer data, that the digital footprint that one has, right? When you bring it all together, you have a universe of predictors that you have. Which one are really relevant when you are using, what kind of data sets one needs to use to start using these as predictors for diabetes as a disease, so that then once you start funneling it down, then you have a sense of what predictors have a strong correlation to an early onset of disease, so that then you can start predicting it upfront, so that then you can start driving care interventions beyond a particular probability threshold, so that you get ahead of it rather than reacting to it all the time. So today, really, most of the care management processes are based on possibly claims data, and it's just a reactive basis after the onset rather than getting ahead of it. So that's really the idea. And if you look at it, the top predictors that we came up with for diabetes as an example are really what you're seeing at the right side, right? So these are some of the top predictors that we have come up with after using a whole set of data sets. And with that, I want to give you an example of how you could possibly use these predictors during the life cycle of a patient. So if you take a 1-year observation period, right, and if you start looking at, on the left-hand side, you have the various parameters across diagnosis, specialty, procedures, and treatments. As and when you start combining some of these predictors, and when during the events that one goes through as a patient, the probability keeps going up the moment the predictors start kicking in. So a patient with an elevated BMI, then over time has another incident where he or she has possibly been, let's say, been diagnosed with MDD, which is major depressive disorder. That individual, along with certain predictors like certain age and ethnicity, suddenly you start seeing a higher probability of a possible disease detection of diabetes for this individual. And so that's event 2. So from 6%, the probability of this person having an early onset of diabetes jumps up to 20%. So as you see over the events, when more and more of these predictors start kicking in, you can be pretty much sure that this individual is going to get into a diabetes eventually. And so you then start customizing these variables and say, okay, what is my threshold? Is it going to be 70%, 80%, 90%? Based on your organization, you decide. And then at that point of time, you start bringing in interventions that you may want to do even before the disease onset of the disease itself. Right? That could be around prior authorization. It could be around specific care intervention programs that you tailor make for that individual. It could be around medical refills, etc., etc. So that's really the idea of how you bring together the data. How do you bring together some predictors of a particular disease? How do you bring in the individual's patient history and longitudinal data, and then bring it all together to start predicting at an individual level where and which individual needs care intervention before the onset of a disease, so that then you can actually meaningfully drive some care interventions that will prevent getting there. So that's really one of the ways to dramatically optimize your medical cost. So this is just a snapshot of how all of this happens. So I've just shared with you a dashboard that we have as Infosys. This kind of shows at an overall level a patient cohort characteristics based on some machine learning. So on the top left corner, what you're seeing is that if you want to get all the patients that you have in your organization that you're serving, with a predictive score of 44 to 96%, and then with an age bracket of 18 to 96, then what the system is showing is that you have actually about 249 who have a potential to get to diabetes, and this is average predictive score of 77%. The age distribution really here is, as you can see, it's about broadly, it's a bell curve with, in the 40 to 80 range, sex ratio of 93% female, 74% male. The ethnicity is just, this is of course an illustrative example of, what is the distribution based on ethnicity. And then on the right-hand side, you see the location or the geography-based distribution. And the top comorbid conditions for patients who have a high potential of picking up diabetes, most of them either have an end-stage renal disease or hypertension, a chronic obstruction disease. So these are the top predictors and the top comorbid conditions that we see. The top procedures are seen in the middle, and the top specialties at the right. So it's just to give you a sense of, how you start managing a population of, as a caregiver or a care manager, how do you kind of manage this population of, people with high disposition based on the 100+ predictors, and that you boil down to a certain few sets of predictors, start using it on your own members, and then drive meaningful care interventions using technologies like AI. So that's really the idea here. So that's a quick background. Vishal, I'm happy to, do you want to add anything from your perspective, particularly on this slide and the previous slide?
Well, I think the only thing I said, this is just a use case on disease detection, but we have been working on therapy transitions. We have been working in rare diseases around underdiagnosis, and also looking at other patient cohorts on the R&D side. So I think it's just a sliver of what we are doing today in terms of our client base.
Great. Thanks, Vishal. So with that, I just wanted to talk about, okay, so all this sounds good. So where do I go from here? What do I need to do? So that's something that we just thought we should share with you all on how do you move forward, because these can be fairly complex, because what we're really talking about is orchestrating external data, the variety of data sources that you have as an organization, internally, externally, and edge devices, right? The sensors data and the wearables data that all members of patients may have. We're talking about bringing together processes that you're deeply embedded right now. How do you tinker or change them to support, a care management process that is driven by technology? And we're also talking about how do you reskill and retrain your care management coordinators or managers to kind of realign to this kind of a thinking. And then, of course, within that, how do you actually bring in that technology to help you drive that kind of a care management process within the organization, which is really the AI and ML piece. So the 4 pieces around persona, AI, ML, the processes, and the device or the evidence-based data that we use to put it all together to kind of drive this intervention meaningfully from a technology perspective to make a much more impactful care management. That's really the game here. And from an engagement approach, broadly what we have seen is most organizations either fall in broadly 3 categories. So you could be in one of them. So the commercial organization, for example, you could be significantly siloed. You may not necessarily have a cross-border or cross-department collaboration for whatever reasons or legacy reasons. Then there is an analytics piece, which is really, where are you in that journey in terms of what kind of data do you have? What kind of analytics capabilities do you have? What is the ability to actually drill in the data and make the data sync to you based on what you need? Where are you in that? What kind of sophistication do you have? And then, of course, the data itself tends to be pretty raw. It needs to be cleaned up. It needs to be extracted from a variety of source systems. You have to put it all together to make meaning out of it. So the dashboard that you saw, while it looks simple, the kind of data that it feeds off is huge, right? And it is also data that's consolidated, aggregated, and analyzed, and then you see the final output. And then, of course, the technology itself, you could have legacy infrastructure, you could have a mix of legacy and some cutting-edge systems. And of course, if you are a very progressive organization who has invested over time on technology, then you probably have a good amount of cutting-edge technology infrastructure already there. So once we an organization like us, we come in, understand where you are in your journey, and then you kind of put down some logical steps of how you want to move forward. What are the core areas that you want to focus on? How do you build these, these elements of capability, be it across the process area, the data area, or the technology area, and then you start going forward from there. So that's really how we operate, and we of course come in and also do an assessment to kind of figure out at an aggregated level where your maturity level is, so that then you know where you stand, and then you can move forward from there in logical steps. From an Infosys perspective, not only do we come and advise you and do an assessment of you, but we also have invested significantly on the ability to ingest all this data that you may have within your organization, or it is available outside the organization, or it could be available from edge devices of your patients. Then we kind of ingest them all, pick them all up, and then start working with them. So the use case that I just showed you was for diabetes, but like Vishal just clarified, we are largely focused on some of these, core diseases that I have listed here. MDD is an area that we're working on, particularly. It's far more sophisticated. It's not just about care interventions, but we're also working on driving precision medicine, where you also look at what drug will work for an individual based on an individual's chemistry. So we kind of use genomic sequencing of that individual and then match it with the chemistry of the drug to figure out which one will you respond to and which will you not respond to. It's again based on a lot of AI and machine learning algorithms that we have built jointly with the research institute. Then, of course, there is smart risk stratification that you could do based on your member population. Again, use clusters of information based on geographical data, and then, of course, data about your own member population and claims data, etc. Then the care management process that we spoke about. So these are broadly what we're doing. We have a comprehensive AI platform that can actually deliver these care interventions across the care continuum. And so this is something that you could hook on to and start using it on a subscription basis. So that's really what I had for this audience today, and I really wanted to keep some time also for answering questions, because we definitely didn't want to just it to be just a monologue. But it's very hard for with especially with such a big audience and everything being virtual. But that's pretty much what I had. So I'm happy to kind of take questions and we can go from there.
Great. That was great, Venky and Abhishek. Thank you very much. We have some questions coming in. The first one, Venky, is for you. If you can start us off, what are you seeing in terms of AI and automation across your clients? What are some of the pitfalls and what are some of the success stories you're seeing?
Sure. Look, one of the pitfalls is, machine learning algorithm is only as good as the training data sets that we can have a handle on. And data tends to be, pretty messy. It's far easier said than done. But typically, data that's available in large enterprises is highly fragmented. It is quite messy. There is a lot of duplicate data that's available. So it's very hard to get a single source of truth for that matter. And so just the sheer fact of, I think Abhishek called it digital plumbing, that can be quite an endeavor, right? So even before while every organization jumps on these initiatives and earnestly looking for answers from day one or day two, the technologists are taking time just to pull it all together, let alone do analysis on them and start giving insights. So that's the biggest challenge, a pitfall that is usually not appreciated enough. So it is worthwhile to be aware of it, work on it, and that's really where it is always better to go with subject matter experts who have been there, done that, so that you know what to look for, how do you bring it all together, and start getting to what really matters, which is really the questions that you have on what kind of meaningful care interventions that you can drive in your patient's journey.
Okay, and what about data sets? What kind of data sets would you need for disease detection? What kinds of other things might be able to help?
I'm going to ask Vishal to answer that. He's a deep expert on this topic. Vishal, you want to take that question?
Sure. So I think data sets nowadays means data is everywhere. So you need to think about the traditional data sets that we talk about, right? The clinical, the claims, when you go to a doctor, how do you prescriptions get dispensed, or you're getting infusions at the doctor's office, all those EMR, so you need those. But in addition to those, the clinical nowadays, you also have the genomics, the diagnostics. So those are some things that start completing the story. Beyond all that, there are a lot of non-traditional data sets that you're getting. Those are the devices, the sensors that you can get. You can also get a lot of the data, the first-party data from companies that are either running patient support programs or care programs. You're getting that. But you can also include behavioral data. So if you think about the clinical data as the higher end of the T, and then as you start putting more and more data, it becomes that the leg of the T. The issue is that the more and more data you start putting in, it becomes thinner and thinner in terms of the patient data. So I think you have to have a choice that you need to make when you start integrating the data, to what level you really need to think about making that decision around disease detection. So something that we are working on, I'll tell you, on prostate cancer, that we are working on just as a therapy transition from first line to second line. And that is something that we are working with around only 6,000 patients, right? Because there are not too many patients, but the history that we have is pretty good around their therapy transition. So it all depends, therapy to therapy, as well as the type of the data.
Okay, and how about time to value? How much time does it take to get AI algorithms and platforms implemented? And that's how long is it taking for customers to realize value there?
Sure. Look, this is a very broad question. Like I said, it's hard to give a general answer because it really is a function of where you are in the maturity curve, which is really why we put something like crawl, walk, and run, which is really where are you from your maturity perspective? What kind of technology capability do you already have or you don't have? What kind of processes do you currently have? What kind of organizational ecosystem have you built so far? So it really is a function of the organization's current state. From there on, it's also a function of what is the problem that you're trying to solve? Is it just about an intervention within a particular disease where you already have a good amount of data sets? Or are you even simply trying to answer basic questions because your care management process as of today is very traditional? There is no real answer to that without having a context. But that's really why I spoke about what we call as the maturity evaluation of an organization. Vishal, you want to talk about that process on how we go about doing the evaluation?
Yeah, so I think the question time to value. I agree with Venky, but I think most of it when we think about maturity across the organization in terms of what we come in, we have like 5 different parameters. Thinking about that strategy to value and how AI is driving strategy to value. It includes the organization, includes the technology, includes the processes, includes even the people skill set. So that's where we have around 150 plus parameters that we rate an organization on. But I think the time to value, what we find is just like telehealth, it has been there for so long, but coronavirus really put it on a fast track. Same is the case with AI, where there are a lot of people who believe in the organizations and who are naysayers. So I think the things that we are seeing with clients is let's do a more proof of concept and let's do this testing and then create a bigger groundswell where we can have a buy-in in the organization and go for more time to value. So I think there are a lot of components, just not on the AI side, but also the intangible components on the organization side, the change management aspect that is huge to actually decrease that time to value.
Okay, excellent. And question for Abhishek. Abhishek, due to the reduced cost of delivering telemedicine care in comparison to in-person treatment, and with there being a massive shift to telemedicine services now, do you have any insight into why costs are actually projected to increase at even a higher rate than prior to COVID-19?
So is your question that why our costs are going to rise because of it, or?
That's the question. And is that what you're seeing, and is that even true?
Not really. Obviously, initially, when you end up adopting some new technology, there is always an adoption curve or a hump that you go through, wherein initial capital investment is required, change management is required, training is required, whether it is patients or clinicians who need to come onto a new platform. There is a lot of transition that is required. And all of that builds up into a cost. And that's why there is always a hump when you are lock, stock, and barrel shifting from one model to another. So that's probably what the question alludes to. In essence, the analysis that we have done comparing the existing model with the remote health model, I think there is significant bloat in the existing model that can be solved via remote health. So let me give you a few examples. One aspect itself is simply the access aspect, like the number of patients clinicians can see during a day. So, I mean, we were running some analysis, and typically primary care physicians would see anywhere between 15 to 20. I'm just picking up numbers anecdotally during a day. Remote health, actually, telehealth applications actually help you expand that. So you can, with agility, shift or move appointments. You can have multiple number of appointments that you can move during the day. So your ability to see many more patients increases. You save on other aspects of cost, like your real estate that you are holding on to for seeing patients, that goes away. There are other aspects in relation to the fact that just the base technology while there might be a adoption cost associated with it, But over a period of time, the economies of scale that you generate from it more than makes up for what you have invested in. So significant ROI is what we see just comparing the two models.
Okay, great. Thank you. And back to Venky and the Infosys team, what are some of the strategies to operationalizing digital transformation in the provider space, and what some ways you can drive impact on care management?
Yeah, Vishal, you have views on what are the strategies to drive transformation in care management?
Yeah, so I think when you think about provider space, I think right now it's all over the place where you have providers at different levels of maturity gain, like you can have a Kaiser Permanente or Intermountain Health to somebody very small network. So I think what we have is when we think about digital transformation, we are looking at AI and A not as a way to be slick and help you drive certain insights or analytics and drive the tactics, but we are also using AI as AI and automation as a way to really transform your organization in terms of cost takeouts. And the cost takeouts, when we are thinking about cost takeouts, we're thinking about process efficiency that is just due to automation, process efficiency to redesign and automation, and then also looking at the overall aspects around change management from a people side. So this is just a very broad, but when we layer in the different functions in the provider space, when we think about the therapy areas, whether it's a research institute or it's a community hospital, so when we start looking at that, there are certain layerings that go in, and obviously the support functions like IT, HR, legal, those things we already have those parameters. What we do come with, there are two things we come up with. One is we already have, based on our experience, we already have use cases, and we apply the AI applicability index around digital transformation, which ones would really drive 60% of the margin or 60% of your cost takeout. And then the second piece that we always come up with is we have like templates and other content that we come up with where we guide the organization into getting digital transformation up and running and in a more self-funded model when we think about cost takeouts rather than having an all spend kind of engagement, but it's more like over a period of time, it's pretty much self-funded.
Okay, and we have time for a couple more questions, which are still rolling in, which is great. Awesome participation. Abhishek, I'd like to jump back to you. How does cross-industry experience help in bringing best-of-breed solutions to clients in your experience?
That's a very good question. In fact, it goes back to that digital divide topic that I was talking about. In many ways, what organizations are currently realizing, especially during the current crisis, is the fact that how business resilience or their ability to align to a changing norm, new normal, so to speak, is getting enabled by where in the maturity curve they are on. I'm going back to the point that Venky was mentioning, because there are organizations, there are industries, clusters, so to speak, who are on different maturity curves, so to speak, when it comes to adoption of digital technologies. Now, what have they been focusing on and what is the direction that they are taking ends up determining what part of the curve they are really on. So if you are currently talking about cross-industry experience, what healthcare can specifically learn from other industries, in fact, what we are witnessing even when we are doing industry-specific analysis is the fact that banking, retail, specifically the ones who focus on e-commerce, etc., have stood out in comparison to other industries when it comes to taking the brunt of the crisis and still succeeding in maintaining business continuity. Now, what are the core components that have helped them do that? One thing has been the whole aspect of digital plumbing that I was alluding to in my presentation is in getting the basic systems in place which allow you to work effectively on consumer experience. And if you port that example to healthcare, we would be talking about patient experience and how internal healthcare systems, maybe it's claims, you're talking about revenue cycle, you're talking about HIT, EHR. While these are very mature systems in themselves, but the plumbing and the interconnecting layers of those, how they can enable patient experience, how they can enable clinician experience that is also a very important topic, as by the bedside, what kind of information they get access to, how soon. That becomes a very, very important factor in their clinical triaging. So that's why, as a supplier or a service provider in the industry, if you are going in, bringing in learning from other industries who are much advanced, who have put in best practices, who have the tools and technologies that could be tweaked for healthcare, I think that can be a very, very good kind of a tool to bring best of breed solutions to clients.
Great, thank you. And one last question to wrap it up, and I'd like to ask the Infosys team to comment. How is COVID really creating opportunities and challenges for the audience? And what should they really know about Infosys as we move forward?
Vishal, you want to take that, Vishal? This
Sure,
is your
sure.
favorite question.
Yeah, so I think COVID is, from a challenges perspective, there are lots of challenges that COVID is creating. It's just trying to have a one version of truth around a patient journey. So if you think about today, people even asymptomatic when they go home, there's not a good way of monitoring them. It's just taking your oxygen levels through a pulse ox. A lot of patients may not know that, and a lot of patients don't have that monitoring system. So if we were to have those things, then think about how we can monitor that and create those interventions that would become opportunities. So all these things, the challenges that we are presenting in COVID become opportunities just at the initial stage. Even when we go through this today, a lot of people, when they go through the hospital, when they get admitted to the hospital, there are patients who are getting on a ventilator for 5 days and they get cured. Some are on 10 days, they get cured, and some beyond that and they die. Now, the thing is, nobody in the system knows what is happening, why it is happening. So again, that's a challenge. But the opportunity is, I was talking to a critical care pulmonologist the other day, and we were talking about how we can use AI to determine what are some of the critical predictors that can tell me that when the patient comes in, based on the risk stratification, how many would go on a 5-day ventilator period compared to a 10-day. And then that creates an opportunity, but it's a challenge today. And then the last thing I would think about from a journey perspective, when you think about patients getting out of the care system, you have patients who are shredding their RNA fragments for a whole month to like a week. So again, the technology creates an opportunity where how can you monitor those people? How can you think about contact tracing? All those aspects that technology can bring to bear, that creates an opportunity. But the challenge today is, if you think about US today, it's only 5 to 7% of the overall population has been infected. So when you think from that perspective, we are still probably, I would say, very early on in this whole journey, and that's a challenge. But if we had all these systems, it would have been great, but now we are looking at all these other opportunities, whether Infosys is working or Apple and Google are working on it, that creates that opportunity. So I just wanted to lay this out from a COVID-specific scenario perspective. I hope that answers the question.
It does, fantastic. And we are out of time. We do, however, want to let you know that the Infosys team will answer all the other questions that we did not get to offline, so please stay tuned for that. Thanks to all of you for joining today. Thank you to our speakers, Abhishek, Venky, and Vishal. Thank you for taking the time to deliver a great presentation and Q&A. Thank you to Infosys for making today's session possible. Just a reminder, the session's been recorded. You will receive an email with a link to the video so you can view it again. If you'd like to access any other webinars and get info on how your organization can speak or sponsor, please visit wcwebed.com. Thanks again to all of you for joining us today. Have a great day, and this now concludes today's discussion.